here's your host, Chelsea Edwards.
Hey, besties. Welcome to another episode of Chattin with Chelsea. I'm your daytime bestie, Chelsea Edwards. New year, new goals. New baby? Maybe. All right. We are talking fertility education today because get this, 70% of women 18 to 40 years old have never, ever had a conversation about fertility with their doctors. So we're going to fix that. We've got a reproductive expert in who's going to tell us all the things we need to know before we're ready to have a baby. Plus, we have a real life couple sharing their real life fertility journey. Meet Daisha and Carlos Ubre, a young married couple fighting to grow their family. Married for 2 years, they're here sharing their journey through IVF, health challenges, and what it means to keep hope alive when the path forward is not easy. Thank you so much for coming on here to share your stories. Appreciate it.
Thank you for having us.
Yeah.
It's a blessing to be here.
Yeah, so a lot of health challenges between the two. And Carlos, you have, you're sensitive to light because of an injury that you had while you were in the military.
Yes, ma'am.
Okay, and tell me about your service.
We got deployed to Iraq, and of course the attacks happened, and that's where I incurred my injury.
And so you've been married 2 years.
Yes.
At what point did you say, like, we're ready for a baby? Usually that's such a fun conversation to have.
Well, we've been together for 5 years, and then the 2 years we've been married, so we knew that we wanted a family, and it was just something that we've always wanted. So I've been struggling with fertility before I met him. In 2015, I was diagnosed with endometriosis.
Oh, wow.
I didn't know the stage or that there were different stages at the time, but I went through having a laparoscopic surgery, and that was when Dr. Christian Smith diagnosed me with it. So I had like a really huge cyst on my right side, and it was causing a lot of pain.
So you all have been trying to figure out how you can have a baby. You visited Aspire Houston Fertility Institute, who will have a doctor from there later in the show, but they sent a letter. What all you've been diagnosed with: polycystic ovary syndrome, stage 4 endometriosis, uterine polyps, uterine fibroids, and diminished ovarian reserve.
Yes.
What was it like when you learned all of this stuff, when you knew that you wanted a baby?
Very heartbreaking. A lot of times I was very emotional, upset. I didn't understand, why me? And I was just trying to figure out, where do I go from here? Because with having those different fertility problems, you struggle with a lot. I also struggle with cystic acne, where I'll get it like on my chin, and weight gain, up and down, fluid retention. You have the endo belly where you get the swelling. So there are times where I'm sticking out, and I may look as if I'm pregnant. So there's quite a lot that goes with it. Just like the stage 4 endometriosis. I had, no idea what it was, and Dr. Rendell, C doesn't say his middle initial, he's awesome, very awesome. He has helped me tremendously, even with my pain, and he has been a great help.
Now, was it the doctor who said, okay, there is still hope, or were you just hopeful, Carlos, even hearing all that? Were you like, we're still gonna do our best to have a baby?
Yes, ma'am.
Yeah.
I was like, okay, this is happening. Let's keep trying.
Okay. So you've been trying.
Yes.
You did IVF already in 2024.
Yes.
What happened with that phase of IVF?
So there's a lot that goes with it. You have to do the hormone shots, and you have to wait until you have like so many follicles, and then they do the retrieval. And then they go through the process of having the sperm and, making the embryos. And so that was quite a bit. And then you have the date where you go in and you have to have the embryo transferred. So everything went pretty smoothly. I mean, of course, you gain the weight because of the hormones. And it resulted in a positive pregnancy test. So me and my husband, we were very happy and excited. Unfortunately, it resulted in a miscarriage, so really heartbreaking, and we want to try again, and we have been trying, but we were told IVF is our best option.
All right, so we're gonna have more on your journey, how you're overcoming even more hardships. We're gonna take a quick commercial break. We'll be right back after this. We're back with Daisha and Carlos sharing their real life fertility journey. So you've been in IVF. You've also become aware of struggles on your side, Carlos, because you had an injury, a separate injury from your eyesight being affected.
Yes, ma'am.
Yeah, so tell us about that.
So we came back from a mission, and my driver, he hit a speed bump. He was driving too fast, and I bounced up and landed on myself.
Oof.
And of course, during that time, I thought it was funny too, because I'm walking like a cowboy who'd been riding a horse too much.
Oh.
And then when I came out, and I believe in 2007, I was in Virginia. I met a doctor that to tell me, hey, it's a chance that you may not be able to have children.
Wow.
So a part of me was happy about it, but another part of me was like, what?
Okay, so that's part of the equation a lot of people don't really talk about on the guy's side. So have you been working to address that as well?
Yes, I've seen a urologist. He said that there's a cell there that is a pocket of fluid there in that side, and it's building up. He said he can remove it, but only one side will only work to produce sperm.
Okay, so you all are still hopeful, still trying to defy the odds.
Yes.
How are you able to pay for IVF? Because people who have been through it, that's one of the things they say, it's expensive and it could be ongoing.
It is. Unfortunately, we're in debt. The VA doesn't cover it for us.
So it's not, even though you're a veteran, this isn't covered at all.
No.
No, ma'am.
They're basing it more so off of Carlos, and since we met, after he was out, so it's like they would do it if I was married to him during the time he was in. So it's a little bit different how they do things. So no.
Not covered.
No.
Are you getting help anywhere else?
No, we've tried grants, and no luck, unfortunately. But we're still hopeful. We're hoping for some kind of resources or something.
Now that's something that I did not know about beforehand, that there are grants for couples having or trying to have babies.
Yes.
What do we call these, or what do people look for?
So there is a grant called Hope for Fertility. I know there's grants also here in Houston. So they have like a website that you can go on, or you can like search IVF fertility grants in the Google search box, and a list of them will just come up, and you go in and you apply. Now some of them do have costs, like a fee, maybe $50, $60.
Oh, so you have to put money in to try
Yes.
to get some money out.
Yes.
How do you advise people in your same situation? Like, this is a tough journey, but you are still pushing forward. You're still applying for grants, trying to find help. What do you tell other couples in a similar situation?
I mean, it is hard. I'm not gonna say it's easy, because going through the IVF, there are a lot of shots. When you first start, you're doing the hormones, and I'm gonna be honest, your hormones are gonna be all over the place.
All over, yeah.
And
Hubby's got to be patient.
yes,
with the hormones all over the place. Yeah.
yes, and also once you're pregnant, you have the progesterone shots, and they're oil based, and they go in your bottom. So, I would say, tell the ladies, don't be surprised if you're having little nodules back there. They'll go away eventually, but it's quite a lot. It's about 11 or 12 weeks that you have to take it while you're pregnant, and then afterwards it's to support the baby. So that's the reason for the progesterone shots.
Okay. Carlos, any other advice?
Just to not give up. Hope, stay together,
Yes.
and keep hope alive, because eventually it will take its course. So I've heard that some people do it within the first round, some people do it within the second round, and I hope me and my wife next round is successful.
Yes, we are hoping the same. We are praying for the best possible outcome for you too. Thank you so much for coming on and sharing your journey. I know it took a lot. All right, guys. Yeah, we got to get some more advice for other couples as well going through this. So coming up, we have a reproductive specialist from Aspire Houston Fertility Institute with tips that you need to know before you're ready for a baby. We'll be right back. We just heard from our couple sharing their fertility journey. It could be emotional, and a lot of times you're looking for answers. So welcome, Dr. Rhiana Saunders from Aspire Houston Fertility Institute. You are a reproductive specialist there, so I'm sure you hear stories like this all the time.
Yes, first of all, my heart goes out to them. It's not an uncommon occurrence, as you can tell. 1 in 6 couples suffers from some sort of fertility struggle. This is what I do day in and day out, and it's what motivates me to try to help couples achieve their family goals.
So I guess one of the things that I see is that we're told most of our lives, this is how to prevent having a baby. This is how to make sure you don't get pregnant. And then when you're ready to have a baby, like, you're supposed to flip a switch and suddenly know all these things about fertility.
Absolutely. It can be shocking to realize that, we spent our younger adult lives trying to prevent pregnancy, and there's so much education out there about contraception options. Unfortunately, we find in our studies that there's little education about how to best prepare ourselves for both fertility and pregnancy outcomes. And, this is the perfect time of year. A lot of folks are kind of setting New Year's resolutions to improve themselves, and this is the perfect time that I really encourage folks that are contemplating pregnancy in 2026 to try to be proactive in optimizing the fertility outcomes.
So what are some ways that we can be proactive and actually, think about our fertility in our everyday lives?
Yeah, sure. So, there are some overarching themes that I like to address with patients. It first starts with weight, and then from there, diet, and certain exposures like alcohol, tobacco, caffeine, and surprisingly, even sleep. And so we address all of them.
All of that. Okay, so let's start with weight. I know that can be a touchy one.
It can be, but it's more than what you might think. It's on the spectrums. So being underweight or overweight can have adverse impact on both men and women. There are some higher level centers of the brain that are in constant communication with a woman's ovaries or a man's testes and signaling the creation of eggs and sperm, as well as hormone production. And when a body is underweight or malnourished or overweight, those signaling mechanisms are disrupted. And so you might see ovulation dysfunction, irregular menstrual cycles, or even abnormal semen analysis parameters or sperm function issues. And so getting that optimal weight is important. And sometimes patients are able to do it on their own, and sometimes they need outside help or resources, and we provide that for them.
Then that's interesting that you pointed out that you could be underweight, and that also affects your ability to have a baby. Now, you talked about some behavior risk factors as well. That's something else. I know we're pushing some buttons, but this is what people need to hear.
Yes, and as difficult as it is to hear, we try to be compassionate about it, understanding everybody's flawed, right? And sometimes they need to hear honest, compassionate information, but also get the resources to help them achieve those goals. So starting with diet, this is closely obviously related to weight. The overall take home that I have for patients is trying to eliminate as much as possible the processed foods. So the things that are coming in boxes or highly successfully advertised packages, and choosing instead of things that are grown from the earth, so vegetables. If you have a sweet tooth, trying to satisfy that with fruit. When it comes to proteins, plant-based proteins, or fish, shellfish, lean, chicken and pork, trying to minimize, you don't have to exclude it entirely, but some of the red meats. You're trying to get rid of some of the trans fats. You're trying to get rid of anything that has a lot of added sugars or other unnatural, constituents within it.
Okay.
So let's talk to the smokers out there.
Yeah,
I know that's a huge one.
For sure. So most physicians unanimously are going to agree that any form of tobacco use has been demonstrated in both men and women to be harmful from a fertility perspective, as well as pregnancy outcome. So women who are smokers can have a shortened time to menopause. They can have a diminished egg supply, or what we call ovarian reserve. There is an increased risk for ectopic pregnancy or miscarriage. And then I kind of lump in other aspects like alcohol intake and caffeine.
Not the caffeine, Doc.
Yeah, I know. Everybody leads a busy life, and I definitely have patients who are like, I can't get through my morning without my coffee, and that's fine. So when it comes to alcohol and caffeine, it really is dose related. So we try to do everything in moderation. You know, if they're celebrating the anniversary, can they have a glass of wine? Yes. You know, if they need that morning coffee to get them going, yes. But the data will show, for example, for alcohol, somewhere between 3 and 6 drinks per week might adversely impact hormone production or pregnancy outcome and even sperm function. So we usually say 1 to 2 drinks a week, really limiting it to those social occasions. And then for caffeine, you know, somewhere between 2 and 3 caffeinated beverages a day might impact pregnancy outcome, like increased risk for miscarriage for some women. So in general, 1 to 2 cups of caffeinated beverages a day is okay, is likely okay. We tend to steer away from the energy drinks or the added sugar soda beverages, trying to really limit it to the coffee and the teas as much as possible.
All right. Yeah. I think that's plenty. We don't want people to be too mad at us.
Yeah.
But what I love that you've mentioned here is that it's not just women. You're not just talking about women and their chances to get pregnant. It's also the men and their sperm counts.
Yes.
Are there other things that can affect those sperm counts as well?
Well, I mentioned earlier a little bit of sleep. So surprisingly, patients with sleep abnormalities or sleep dysfunction like insomnia or obstructive sleep apnea have been shown to have decreased semen analysis parameters as well. And sometimes ovulation dysfunction. And sometimes patients need to have a more thorough evaluation, a sleep study, to figure out really what the underlying causes are. And then there are sometimes behavioral changes that we can do to maximize the quality of our sleep. Some of that is getting rid of the phone at night.
Ouch.
And so there's what we call sleep hygiene that you can do as well.
Yeah, okay. And then a lot of guys are taking testosterone nowadays.
Yes.
Look, you close your eyes and like, oh my goodness.
Yes.
And you may think that, okay, that's going to make you a little more manly, pick up that count, but that is not the case.
Yeah. Highly effective marketing out there for testosterone use. So we've seen a huge uptake in gentlemen taking testosterone, and there are definitely appropriate situations and places for that. It has its use. It doesn't necessarily relate to better sperm quality. In fact, it's quite the opposite. It can truly drive down sperm counts to the negligible range. And it's not an uncommon conversation for me to have, telling couples that this has been preventing, pregnancy, and we need to address it. So certainly before taking testosterone, I advise all gentlemen to address their future fertility needs first.
Wow. Okay. Great info. I have to point out, you have 3 kids yourself.
I do.
Yes, and you're also a former military.
Yeah.
You retired from the military after 20 years.
Yes.
Wow. Okay.
Yeah.
Are there certain things certain challenges that you see with military couples?
Sure. The challenges that most resonate with me is the constant tempo of moving or deployments, disrupting the time for, couples to be together, and access. Not every military family is stationed in a location where they have access to fertility services. So sometimes they have to travel long distances, or they have to seek services outside in the civilian sector, if in a location where it's even present.
So many things that we often don't consider. Great information again, but we've got to take a quick commercial break. When we come back, we're going to talk about solutions if you need help with fertility. Be right back after this. Welcome back. Before we go, we have to talk about solutions when it comes to fertility, because it can be an expensive process. So what can people do if their insurance does not cover fertility treatments?
Yeah. For sure, we recognize that finances can be a big burden in accessing fertility care services. The first thing I would say is not every fertility clinic or physician is going to point patients down a path of the most aggressive, most expensive fertility treatment option. Not everybody needs IVF, for example. We do tailor it to whatever their unique needs are, you know, and sometimes it's fairly inexpensive care, and some people might have been misled and therefore they don't even approach getting that first consult. So most fertility clinics, Aspire, HFI included, have a fertility financial counselor who is an expert in understanding different insurance plans and policies, helping patients to understand what is or isn't covered. Sometimes they're surprised to see that they have coverage they didn't know they had, at least for certain diagnostic testing, and same with medicines and sometimes with treatments. And so the financial counselor really walks them through what is or isn't included, what their deductibles, co-pays, all that type of information. But then they also have other resources. So there may be grants that they're aware of that come up periodically throughout the year that patients can apply for and get financial assistance. They also have financial packages where you can kind of bundle some packages. There actually is a program called Bundle where you can get more packages for different types of fertility treatment at discounted rates, and some of them even include financial guarantees, sort of safeguarding some of their financial, you know, finances from loss, so to speak.
Okay, so there is hope.
There is hope.
You just gotta make a call and
Yes.
start getting some information.
Exactly.
All right. Thank you again, Dr. Saunders. This is life-changing and life-making information. Thank you to our courageous couple for sharing their story. You guys can check out Aspire Houston Fertility Institute to get started on your own journey. Be sure to follow us on Chelsea Show Fox and subscribe on YouTube, of course, at Chattin with Chelsea. And we will see you on the next Chattin with Chelsea.